Breastfeeding is good, but when it comes to being beaten or when it comes to a cracked nipple, why moms go through a lot. Have a look at these pictures. What can you gather?
What women go through, only God knows. Guys, welcome again back to my channel. Imagine having a cracked nipple. No woman would ever want to go through this. A cracked nipple. It is so painful and super painful. My God. That feeling when the baby wakes up and you imagine that you will still breastfeed the same breast. Where? No wonder we are called women of power because you will still breastfeed your child. You cannot throw away the baby. You cannot beat the baby because they are very innocent and they don't even have an idea of what you are going through. So it's upon you, mom, to be courageous and take it easy because your baby needs you at that particular moment so that they can take the milk, breastfeed, and grow. Moms, this is an advice to you. Respect the hunger cues of your babies. There are three stages of hunger cues. They are divided into three: the early stage, the mid stage, and the late stage. In the early stage of hunger cues, you find out the baby is wiggling from side to side in readiness to feed. They make movements of their legs and arms, rooting that when they are touched on the side of the cheeks, they will tend to open their mouth towards that thing that have touched them. Then they put their fingers in the mouth. So we are done with the first early stage of hunger cues. If you don't respect that, they move to the mid stage or the late stage. In the mid stage of hunger cues, the baby will be fussy. This baby is very difficult to please and is very unhappy. Then they make squeaky noises, especially when breathing. Then they are restless and usually cry intermittently. If you don't respect that, they go to the late stage of hunger cues. In the late stage of hunger cues, you'll find that the baby fully cries. The baby is aversive and screaming with a high-pitched sound. And also, the color turns red. The baby is very difficult to calm down. In general, we say these are stages of readiness to feed for a child. And if these stages are not respected, these babies are very, very angry with you, moms. Therefore, it is always advisable to respect the feelings of your child before they get to the worst stage. And why do you think I brought this in? It's because an angry baby or a hungry baby is very difficult to calm and can easily bite you. And this could be the first cause of a cracked nipple. The second cause of a cracked nipple is infection. For example, if your baby has oral thrush. Somehow, the first two are inevitable. The third and the most important cause of a cracked nipple is bad latching. I have always talked about this in my previous videos on expressing breast milk by use of hands or by use of pumps. I've also explained this in the video of types of nipples and also in my video on breastfeeding positions. Why do you think I keep insisting this? It is because with a good nipple and with good latching, you're going to achieve breastfeeding. You're also going to achieve bonding. And what is the end result? A happy baby and a happy mother who will be both satisfied. And you're gonna remain to be a stress-free mama. And what if along the way you sustained a cracked nipple? How do you treat it, or how do you go about it? Number one thing, and the cheapest and the best ointment ever, is the drop of your breast milk. When the baby is done with breastfeeding, squeeze the areola of your breast so that the milk drips on the nipple. Once it is dropped on the nipple, you use your clean hands to apply it around the nipple and allow it to dry thoroughly. It's advisable to keep breastfeeding the baby on the same breast. Position the baby in your most comfortable position. Allow the baby to open the mouth by either touching the ridge of the nose using the nipple or touching the chin of your baby using your middle finger that is holding the breast in a C grasp position. When you achieve the opening of the baby's mouth, you now fix your nipple inside the baby's mouth by allowing the full nipple to get inside and most of the upper part of the nipple to be inside. The lip should be inside out, and also when breastfeeding you will see that like the cheeks are getting full because the baby is getting satisfied. Then you will see the baby is forcing in between the feeds. Eventually, the baby will allow the nipple to slip away once it's full. If you want to interrupt breastfeeding, of which it is not advisable, but if you get to that point, you need to fix your little finger inside the baby's mouth and then pull out the nipple. You don't just pull out the nipple while the baby is breastfeeding because you're going to crack a lot. That's also another cause of cracking your nipple. If applying the milk did not work for your cracked nipple, you can apply an ointment called lanolin. It helps in healing your nipple. And if you can't afford the ointment, the best ointment is right in your breasts, your breast milk. How do you prevent a cracked nipple? Number one is proper breast attachment and proper latching. Number two, if your baby have oral thrush, please go to the hospital setup, see your doctor to treat it. Number three is respecting the hunger cues of your baby. Number four, avoid pulling out your nipple from the baby's mouth when it is breastfeeding time. If you don't want to breastfeed your baby on that breast which is having cracked nipple, it is advisable that you express that milk fully to prevent breast engorgement and to prevent infections of the breast. Moms, if you don't know how to express, I have covered you. I have covered this in my previous video of expressing breast milk using both hands or manually or using a breast pump. After expressing your breast milk, just store it using the storage bags or the storage cups in the deep freezer. It can stay there for up to around 6 months, so you're safe. If in any case you want to go to work or you are away from the baby, your nanny can help you feed your baby with your breast milk. If you watched this video and your nipple healed, I'm so happy. I'm so happy for you. Now continue breastfeeding for up to 2 years so that your baby can be fully breastfed. Please consider subscribing and share to other mothers who might be suffering the same. May this video circulate in all the continents to help all breastfeeding moms. Nasket Irungu is wishing you all the best during your breastfeeding and requesting you to comment down below if it worked for you or how did it work for you so that moms can learn. Take care of yourselves and your families too. Goodbye.